A lot of people, including myself, develop a habit of grinding their teeth, clenching their teeth, and most of the people that do that do it at night. They may do it during the day some, but at night is when the damage is done. And by damage, you'll bite down at least 10 times harder when you're grinding at night and you're asleep, because your brain's kind of shut down and not controlling those muscles like it does during the day. And so if you're clenching or you're grinding your teeth, something's got to give. And some people who clench and grind, they have joint pain. And some people break their teeth. Some people, their teeth get loose. There's all different things that can happen. You can have muscle soreness and headaches as a result of that. But it's all coming from the same thing of grinding and clenching your teeth. Once you get into that habit, a lot of times you're never going to stop. You can move to an island, live on the beach, but you're probably still going to grind your teeth. We can't keep you from grinding and clenching, but we can protect the teeth, we can protect the joint, and keep you from doing any more damage. I tell patients all the time, when I was 20 years old and I was running every day, my knees would pop, but it didn't hurt. And now they pop and they hurt afterwards. And it's the same thing with the joints. The TMJ, temporomandibular joint, is that there's a disc in there, and you overwork that thing as you're young, and as you get older, you start to notice issues with that degeneration there, almost arthritic changes in the joint. We try to catch that as early as we can, because I see college kids all the time who show that sign of wear on their teeth where they're grinding them, or they're starting to mention that they're having headaches. And there's not a lot of sign on their teeth when they're that age, but it's just the early stages of the TMJ, or actually TMD, which is temporomandibular dysfunction, and the TMJ is the joint. We try to catch that as early as we can, stay on top of it, and that way when they get to be older, they're not having all these arthritic changes or the pain with their joints that you can have if left untreated.